Hi, I'm Kurt Palmer, and for the last 15 or so years, my family and I have lived in Simsbury, and we've been very fortunate to be able to take advantage of so many of the assets that Simsbury has to offer, whether it's youth groups, youth programs, our schools, places to eat and shop, open public lands. Simsbury really has an awful lot to offer. But it occurred to me the other day that there's another part of Simsbury that is really significant, and it's the people asset that Simsbury has. I've spent my career in healthcare and insurance and employee benefits, and it occurs to me that in Simsbury we have a tremendous amount of leadership and talent in the healthcare and insurance business. So over the next few weeks and months, it'll be my pleasure and privilege to introduce you to some of the folks that work and live in Simsbury that are in the healthcare and insurance and employee benefits business, folks that are doing great things to change the industry, to make a difference, to lead, and really have an impact. So I look forward to introducing them to you. I thought it'd be fun and interesting for you to meet some of your neighbors and coworkers, and so I welcome you to join in with us each time. I'm very, very pleased to have as my first guest in this program, Rick Brush. Rick has a very deep healthcare background, spent many years at Cigna in leadership positions, and is most recently the CEO and founder of a group called Collectve Health. And I'll give Rick every opportunity to talk more about that, but Rick, welcome and thank you for being here.
Thanks, Kurt. Glad to be here.
I guess the first question is, how did you happen to end up in Simsbury? How long have you been here, and how did you come to live here?
Yeah. So my wife and I moved here in 2002, and we had one child at the time. He was 1 year old, and we picked Simsbury. Really, we were looking at getting back to the East Coast. We were living just outside of Detroit. I was working for Ford at the time, and our families are both from the East Coast. We're from New Jersey. So we had our sights set geographically this way, and what really led me here was the opportunity to work with Cigna.
Mm-hmm. And so tell us a little bit about your background in healthcare, and maybe with an emphasis on what you're doing today, both what your organization is about and some of the things you're doing with it personally.
Yeah, so when I was leaving Michigan and in the industry, primarily I was in the financial services industry. At Ford, I worked at Ford Credit, and the work that I was doing there was strategic planning work, and it was a particular kind of strategic planning where we really focused on the customer and understood more clearly what the customer, anticipating customer needs in the future. And one of the ways we did that was really engaging employees in the organization who were on the front lines, mm-hmm. and getting closer to what the real needs were that were emerging. I thought that that approach was very powerful to bring to the health industry, the healthcare industry. And so I set my sights on switching over from financial services into healthcare, and I was looking for organizations that were receptive to this sort of approach. And Cigna was really at a turning point, looking beyond traditional ways of dealing with healthcare and looking more at the individual level and ways to make the individual better equipped to make better decisions and so forth. So I spent about a decade at Cigna, and I learned a lot. And I worked a lot with the national account customers, large employers that are willing to take a long view and look more at a population level at what matters to health, and make some strategic bets on how to improve the health of the workforce and the dependents. And that opened up for me a real curiosity around, what beyond health care really matters to health. Mm-hmm. And over the course of almost a decade at Cigna, I became aware of the determinants of health. And the determinants of health really say that about 10% of what matters to our health is the health care system, doctors, hospitals, pharmaceuticals, the medical care system. So what's that other 90%? And I became fascinated in understanding what these larger influences of health might be and what the opportunities might be in the marketplace to improve those larger factors that matter to health. So fast forward about a decade to when I left Cigna. Really, creating Collectve Health was based on two ideas. One is that there is a very strong business case for investing in non-medical, population-level approaches that both improve health and ultimately bring down healthcare costs. And if I could make a business case for that, I think that I could get more capital invested in those larger approaches. And then the second idea was that, well, we need innovative financing mechanisms to pay for these larger investments in population health. Because at the time, about 5 years ago, most of the industry was still very much fee-for-service, still very much focused on funding the transactions of healthcare delivery. And we needed to look at some more innovative ways to start flowing capital again to these population-based approaches. So that's what was the genesis of Collectve Health. Collectve Health is an organization that works with both public and private entities, whether those are insurers and payers, employers, or governments and communities, to understand what more fundamentally is driving positive health outcomes and could drive positive financial outcomes, and then to put in place these strategies and measure the impact.
It really is a transformational approach. As you said, fee-for-service, transaction-based administration and funding of healthcare maybe has seen its day, and there's a lot more going on, pay-for-performance and outcomes-based and so forth. So it's a really interesting place in the industry that you're heading. I know from your background that Collectve Health is related to yet another initiative which is really focused on community wellness, community health, maybe taking into account some of the things you just described. But the program Way to Wellville is one that I know you're deeply involved in. So maybe you could share a little bit about what the Way to Wellville is and what it means to those communities and sort of how it fits in the overall sphere of healthcare.
Sure. So I'll tell you a quick story. About three years ago, I met a very influential angel investor who has been involved in the technology sector for some time. Her name is Esther Dyson. And Esther originally began as a reporter for the Wall Street Journal, and she was covering the technology sector. And then she became an analyst, and ultimately she started making some investments that paid off in the technology sector. So these days, Esther's really interested in making an impact in health. So moving from technology exclusively to this broader idea of what really influences health. And the two are related because there are ways to bring the best of technology into supporting health improvement, both at an individual and a population basis. So I met Esther, and she's very honest, and she said, "Well, I like big, gnarly problems, but I don't know anything about health. And you know about health, and you've worked in healthcare and a payer. Maybe we could join forces and launch this new initiative." And so that's what we did. So in 2014, we launched a call for applications for what we called the Way to Wellville. And the Way to Wellville simply is a 5-year, 5-community health challenge where we provide support, we provide access to partners, sometimes corporate partners, organizational partners, sometimes investors and funders. But really the idea is to get behind communities that are serious about health change and that are going about it in an integrated way so that you have health plans and insurers working together with employers, working together with public health and local government and community agencies and faith organizations and schools. So it's a very broad-based approach to improving the overall health of a population over the 5-year period. So we selected our communities in 2014, and the 5-year challenge started January 1st of 2015, so we're about a year in already.
And I think you're probably seeing plenty of success already in progress. You talked about the 90% determinants of health and so many of those things, where you live, what kind of support system you have, what kind of employment you have, all of those things contribute, and sounds like you've got all of the the different sectors of a community involved to address each of their own respective issues, but also tying them all together because they are so cross-related.
That's right. So, we really, in this early conversation with Esther, we started with a question. And we said, okay, we spend almost $3 trillion every single year on healthcare in this country. What's the return? And she's an investor, so that's an obvious question for her. And if you really look at where we spend the dollars, about 97% of that money is spent in the healthcare system, and only about 3% is invested in population-based prevention and health improvement initiatives that really could avoid the need for downstream care in the first place. And so, as you mentioned, within that 90% of what matters to health outside the healthcare system, it's education, it's food systems, it's the built environment and parks and places to be active. Mm-hmm. It's the work environment. It's the economic, social, and cultural framework of a community. And these are all really big factors to tackle alone. So the idea behind Way to Wellville is that we bring multiple stakeholders together who all have an interest in improving these larger factors because in some way they're going to benefit from the overall improvement in health in their community. Obviously, insurers and payers are going to benefit from reduced healthcare costs. But each of them probably a little sliver. Not one payer isn't going to realize all the benefits. So how do you bring these stakeholders together in a way that they can share interest, investment, and ultimately return by collaborating on community-wide initiatives? And that's what we're doing with these coalitions in Wellville.
Yeah, I imagine it is a major undertaking and not an easy thing to get all those folks that may have different agendas together, but once you do, the force of that collaboration's got to be tremendous, and it should make a huge impact in improving, and focused on the prevention too, which is such a big part of this. Much is made in this industry of the problems, the cost, the administrative inefficiencies, the uncertainty of the outcomes when it comes to the delivery of care, things of that kind, and people focus on what's wrong. What's your perspective on some of the things that are right, some of the innovative things that are happening? Obviously, what you're involved with is one of them. Are there some other things that you're aware of or that you can point to that are positives, that are things that are going to help and benefit the industry and really eliminate some of those issues that people have traditionally, historically gotten kind of upset and vexed about?
Yeah, what I'm most excited about is where we see the notion of health moving beyond the clinic and into the community. And that doesn't mean that we don't need good clinical care, and we need to continue to make that higher quality and greater access, and reduce inefficiencies and costs in that system as well. But what I'm seeing is that there's actually an opportunity to integrate between the clinic and the community. So I'll give you a few examples. One of our Wellville communities is Spartanburg, South Carolina. And Spartanburg selected 5 focus areas for their 5-year Way to Wellville challenge. One is to improve access to care for the uninsured. 2 is to improve health outcomes for those who do have insurance. So typically this is a employer-based population, or they're insured in other ways. But they're not maximizing their benefits. They may not be taking advantage of wellness programs. So there's a lot of opportunity to improve health outcomes there as well. The third area is obesity prevention, and that's the one I'll talk a little bit more about. Fourth is, believe it or not, kindergarten readiness. And this is based on the understanding that early investment in childhood development and education pays off multiple times over the life course. And so in the short term, investing in pre-kindergarten, Head Start programs and so forth, we know that you can measure the benefit in achievement in kindergarten and reading scores and 3rd grade readiness and all the way through to high school. And ultimately, you can even track that to college graduation rates and then employment rates and so forth. But in the short term, the way Spartanburg is looking at this is the investment in early childhood education is actually offset by the reduction in special education costs. So right now in parts of Spartanburg, only about a third of the children are getting access to pre-K. And so an example in Spartanburg is to invest in availability of pre-K, and the city of Spartanburg, in providing that, is now tracking the impact of the reduction in special education costs. So kids coming into kindergarten don't need as much additional support from special ed, which is extremely costly. And by the way, also puts the child ultimately at some challenges in catching up. So the fifth area Spartanburg is focused on is community pride. And again, I think it's an interesting example because we know from the evidence that social capital, something we have a lot of here in Simsbury, neighbors coming together, being on the ball field together, high civic involvement, and volunteerism, and really pride in a community correlates to better health outcomes. And what Spartanburg is facing is that there are pockets of the community where people feel disengaged from the community specifically, and also in this effort to improve overall health in the community. And so there's a focused effort now in engaging neighborhood by neighborhood participation in creating a healthier community. And some of the things they're doing, they're mapping currently the availability of affordable, healthy food. They have a goal that everyone in the community ultimately will live a half mile within green space or near green space, and no-cost places to exercise outside. And all of this is being driven by the community itself. And that's creating more involvement and engagement in the community, and ultimately better health outcomes in the community.
It's interesting. I know it's too early yet to know the full outcome of what's happening in those 5 communities that the Way to Wellville is focused on. But I wonder if there's anything fundamental or a characteristic of those communities such that you couldn't do the same kinds of things pretty much anywhere. In other words, well, Greater Hartford, for example, I'm sure in many ways could use the kind of focus and attention and specific programs that you're putting up in Spartanburg and other places. Is there anything about those communities that make them so different or special or unique that you couldn't take these same programs and apply them, say, in a Greater Hartford?
That's exactly, Kurt, the point of the Way to Wellville is to learn what works, what doesn't work, so both successes and failures, and then ultimately after 5 years to have a good body of evidence that we can spread to other communities. You mentioned Hartford. I know Cigna, for example, is working in a neighborhood in Hartford on this kind of community revitalization effort that's led from inside the community by the residents of the community itself, but it's then supported by organizations like Cigna. And Cigna is bringing capabilities like analytics capabilities and nurse health coaching capabilities into the community to really understand what drives better health outcomes. But I think importantly, it's being driven from within. And that's sort of our formula for the Way to Wellville. Another quick example outside of Wellville is another initiative I'm working on is related to childhood asthma. And I've been working in Fresno, California, which has very high rates of childhood asthma. And in the neighborhoods that we're working to improve outcomes, we know that the housing quality and air quality is a pretty big factor in terms of what's driving kids into the emergency room and hospital at a frequent rate related to asthma. So we've been piloting a program with community health workers that are visiting the homes of kids who have been frequently in the ER and hospital. And the community health workers are educating the family around environmental triggers, dust and mold and pets and smoking and harsh cleaning products. And with some pretty simple changes in the home, you see dramatic results. And the reason we're doing this is that it's such a simple intervention that could be replicated many different places. And there's a lot of good evidence that it improves both health outcomes as well as reduce unnecessary emergency utilization and costs. But it's typically not funded through insurance and health benefits.
Right.
So we're looking, here's one of the places that we're looking at creative financing vehicles, and one of the vehicles is Pay for Success. If we can get investors to pay for this home-based asthma management approach, and we can demonstrate through outcomes that we're improving health as well as reducing healthcare costs, then the Pay for Success contract would be that the insurer would pay back the investors based on tangible cost savings through the program. I think that's an example of something that can be spread, and there's a lot of, again, non-medical, community-based health interventions that have really good evidence but typically aren't funded beyond grants and philanthropy. And what we're trying to do is bring those to the marketplace because we think that there's both a case for the health outcomes that are produced, and there's a business case around the financial outcomes that are produced.
It makes sense. In terms of technology, I know you're not necessarily a technology expert, although I don't want to sell you short on that. But in terms of things like telemedicine, which seems to be becoming pretty popular, a lot of focus on it. You read in the papers that telehealth and remote visits with your doctor over Skype or you know, over the phone even are really grabbing hold. And I don't know if that is anything that you're incorporating into what you're doing in the communities, or maybe just your point of view on that generally and how technology is affecting the healthcare and insurance business.
So quite a bit, especially in way to Wellville, given Esther and her background, but also because that's where we're seeing a lot of innovation. And what's really interesting is that there are so many startups now in the technology sector that are starting to tackle these very specific problems. And one of the contributions that we make to these Wellville communities are introductions to partners that want to play a part in improving the population health outcomes in these communities. So I'll give you two quick examples. One is in Spartanburg, South Carolina, where there's this high uninsured population. There's a group called Access Health Spartanburg. And they align people who need care with volunteer doctors who are willing to provide care. So they're filling a gap on access to care for the uninsured. But they also have care managers, and those care managers work with individuals with chronic conditions, often multiple chronic conditions, and they're really understaffed. And what they wanted to do was improve, the number of individuals that they could serve, as well as the number of touch points and the frequency of interaction, so that they could do more frequent follow-up and appointment reminders and assist individuals with self-care. So we introduced a health technology organization called Care Message that's providing text message support. And it's very customized around Access Health and their care management model, and then doing very targeted outreach to individuals. So, it's too early to tell what the impact is, but it's an example of where technology is going to, allow them to have much more frequency of reach and follow-up. And then the other example is in Niagara Falls, New York, which is another one of our Wellville communities. We know that the National Diabetes Prevention Program has a lot of good evidence for it. It's really proven to slow the transitions or prevent transitions from pre-diabetes to diabetes. And that's worth obviously a lot in terms of health outcomes, but also financial outcomes too. One of the challenges with the National Diabetes Prevention Program is that it's super intensive in terms of coaching resources, and often it's run through YMCAs. And sometimes they can't meet the need. So we're working with another technology provider, and it's called Omada Health, and they provide virtual delivery of the National Diabetes Prevention Program. So now we're taking that coaching model online. So we're trying to expand the reach again of coaches either working with the YMCA and existing providers, or bringing new providers into the community through this virtual delivery. And they've gotten really great outcomes in terms of, again, reducing risk for diabetes, sustained weight loss measurement, And so I think there's great opportunities for technology in health sector and working with communities.
Yeah, I think one of the things that I've seen is the absolute explosive growth of the use of mobile applications, because so much of our population, doesn't matter what, where you are, or where you are on the economic scale or any of that, but almost everybody has a smartphone and can access that kind of information. And so it just opens up enormous possibilities for how you connect to people, how you deliver information, how they access things that will help them manage their care, or really preempt some of the things that would otherwise cause problems in their health conditions. So no doubt technology is going to play a role. It's often said that Hartford in this area is the insurance capital of the world, and we still have some major companies that are leaders in the industry, obviously Cigna and Aetna and United Health, although some of those headquarters are moving away from Hartford. But do you feel that this is still a good place to do this kind of work? Does it matter? Is it still, that kind of center of healthcare and insurance business, the way it has been, or is it changed?
Well, I think it is changing. I think I appreciate what you said about one of the assets here are the people, and you're an example of that. I think the people that you'll have come on this program are an example of that. And I think so. I don't think that we've lost the status of being a hub of healthcare and health insurance. I think what's changing though is how that whole market is evolving, and there's so many opportunities now to make an impact on health that go beyond everyone carrying an insurance card, and I think that we've seen that evolution in my 14 years now almost living in this community and being part of the industry. We're seeing that positive evolution.
Right.
But from the sheer number of people who work for the larger players who are here, as well as lots of startups and entrepreneurs and consultants, I think it's a good place to be positioned and to draw talent from.
Well, there's no doubt that you are yourself a perfect example of the kind of leadership and talent that exists in this industry, in this area, but specifically right here in Simsbury. It's great to have folks like you living in our community, and the information you provided is really interesting, and you're doing some great things, so congratulations on that. And I really appreciate your being with us. And to our viewers, thank you for joining in, and we appreciate your listening to our program and hearing all of the great things that Rick is doing. We'll certainly introduce others in our community that are involved in this healthcare and insurance business, and themselves are leaders. So with that, we'll say goodbye and hope we see you next time. Thanks very much.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.